Occupational health is a nursing field of study that goes in depth into the health of employees within their working environment to ensure that they are safe and working effectively on their jobs. It also incorporates safety measures as well. Your employer has referred you for occupational health so that you can do a medical examination to determine if there are any health issues so that they know that you can cope with your job. The difference between pre-employment annual medicals and exit medicals is basically your pre-employment medical is to ascertain a baseline. So we want to see the baseline of your health in terms of your blood pressure, your blood sugar, and what you can cope with in your job. So we look at what exactly is expected of you, and we then see whether you are fit enough for that particular job. An annual medical examination is part of a risk management program and is often legislated by law that you need to do an annual medical. The general certification of your medicals normally lasts 1 year. So you would then on a yearly basis come back and redo your medical just so that your employer is appraised if anything has changed, if your blood pressure has changed, if you have become diabetic or have had an injury and you can't cope with your work, then that will be picked up during that annual medical. The exit medical is basically to ensure that you haven't been exposed to any hazards within your working environment, and it also protects your employer because he will then know that when you left this job you do not have any claim against your employer in terms of occupational disease or any injuries. Your medicals are normally done on an annual basis. They can be done in a shorter period if there was an accident and there is a follow-up to just make sure that you are healthy and fit for the job. Normally it is annually, and our legislation and the certificates only last for that period of time. Legislation also requires, especially in terms of the building regulations, that is legally compliant to do an annual medical certificate. Your employer will not see your medical records because the interview and the testing that is done and the results of all the testing is confidential. The only test results that your employer will see will be those tests that are directly related to compliance with the Act and also any exposure that you may or could be exposed to. So those would be things like your audio, which is your hearing test, your eye test, which is a keystone test, and also any drug testing that your company requires us to do, as well as maybe biological monitoring. Those results can also be provided as proof that action needs to be taken in terms of your health and your safety. You cannot be fired if you are found to be unfit for duty according to your medical surveillance testing. If it is a condition that you have developed, your employer is required to give you a time period for you to address the medical issue, in which case you would see a doctor and there would be a follow-up plan to get you back on your feet and healthy again. Perhaps the employer may have to put you on light duty for a time period to integrate you back into the working environment, but you cannot be fired based on the fact that you have become ill. Who should do medicals? Almost all occupations have some part of the occupation or the job that could be stressful to the employee. So depending on what industry you are in, most industries, especially the heavier industrial type industries, require definitely medical examinations. Even your executive medicals cover executives, people in high functioning, stressful jobs, and they also need a medical examination. So yes, pretty much everybody could do the medical examinations. The Occupational Health Fitness Medical Report contains basically a statement regarding your health, and that would be that you are fit for duty. You could be fit for duty with exclusions. Perhaps you have a blood pressure problem and that needs to be sorted out, and then after that it is a declaration of fitness after your blood pressure has been reviewed. So any exclusions will be in there. Also referrals to the occupational medical practitioner, depending on what type of medical that you do, and also your reports, the reports that are available to the employer, which would be your audiometry report, your eye testing reports, and also perhaps drug testing reports is then included in that occupational health fitness report. No confidential information is stipulated on this report, and of course the report or the certificate will tell you how long it is valid for, and or if you need to have a review, perhaps 7 days or within a month. So that is exactly what is stipulated on that report. The construction regulations covers everything to do with construction. It is basically a risk management system. It is a legal system where the construction management have to comply with documentation and all the processes and all the actions that happen on a construction site. It also covers all the training and all the protective equipment that needs to be used on a construction site. And that stipulates that you have to have an annual medical fitness certificate to be able to work on a construction site. The Annexure 3 document is basically a medical fitness document. It's a legal document where it is looking at what is your job, what are your possible exposures, and what are your specific exposures, and what is the personal protective equipment that you need to be used. It is signed off by the occupational health nurse practitioner and also the occupational medical practitioner. So all the registration and practice numbers have to be exhibited on that legal document. Well, a general medical is basically your basic entry medical. It is usually for office workers, people that work on the ground. Could also be just your food handlers in industry. A basic medical is required there. So it would be covering your blood pressure and also your basically your general health questions, and it also includes an audiometry or a hearing test as well. Your eyes will be tested, but it is not a complicated eye test. These are just basic tests and questions to establish your basic health profile. A referral means it is a note to communicate to your doctor or to the clinic. It will state why we are sending you to them. Basically, if your blood pressure is abnormal, exactly what the readings are. If your sugar is too high, we will write that down, and we will ask the clinic or the doctor to investigate further and to give you treatment and also to report back. Some of the industries that require a basic medical would be office workers, the corporate environment, and also during a pre-employment screening process, they might want to establish whether you are generally healthy before placement in a particular job, and also the food industry predominantly, and packaging factories, those type of jobs that are not areas where you would have further risks like heights or heavy industry. So that's when you would just do a basic medical. Okay, so if you're working in confined space, that would be a working on heights medical. The confined space questions that are asked forms part of the working on heights medical. Now, the working on heights medical is, as I said, a combination, and there you would ascertain whether or not you are afraid to work in a confined space. Confined space really means, do you have enough oxygen or free air to breathe within that small area that you're working in? So it is a very important psychological question that is asked in the Working on Heights questionnaire. The Working on Heights questionnaire is an important document to establish more on the psychological side. Is the employee comfortable to work on a particular height? The height that you work at is also stipulated. And should you have any fears or any conditions like blood pressure or you're diabetic, it's important that we note it on this questionnaire as well. The other part of the questions also extend to your mental health in terms of working on heights. Is there a risk factor? Do you suffer from anxiety or depression? Have you got a history of attempted suicide? So really it is more psychologically aligned, that particular questionnaire. The Working on Heights medical builds on the general medical. The basic tests are still in place. With the Working on Heights medical, the testing and the questioning is slightly different. We checked your blood sugar. If you're working on heights, then we need to know that you are not suffering from diabetes and you can't fall off the heights and getting dizzy. Also your blood pressure, we ascertain that you don't have epilepsy, and then more of your psychological questions are incorporated in the Working on Heights medical. In terms of who signs off on the Working on Heights medical, the occupational health nursing practitioner signs off, as well as the occupational medical practitioner. The occupational health sister will sign off because of the evidence of the testing that has been done and the questions that have been asked. The medical practitioner's real job actually is to manage any disease that is discovered during the questioning process. So as far as that is concerned, the person will then, if they need treatment, the doctor will then decide what sort of treatment they would then need. So both occupational health nurses and doctors sign off on the Working on Heights medical. For Working on Heights, some of their job descriptions will be people that specifically work on extreme heights, like your telecoms industry, and also fishing boats, crane operators, and in industry, in the construction industry, you also have Working on Heights. Those are the types of jobs. If you just have a Working on Heights medical certificate, you cannot do work in a heavy industry, like when you're an electrician, and even though you are still going on heights, there are other medicals like the operator medical, which basically covers the more heavy industry. So Working on Heights is specifically geared for people that actually work on heights, whereas an operators, it is more in-depth testing. For instance, your eye testing is different. You do not need a keystone test with a Working on Heights medical, whereas if you do an operator medical, you definitely do. The operator medical is basically the third tier in the medical. So you basically have your basic medical, you have your Working on Heights medical, and then you have your operator medical. The operator medical includes absolutely everything in the basic and the Working on Heights medical. The basic difference is that you would do more advanced eye testing for an operator medical. This would be for drivers in the transport industry, and you would also, of course, your blood pressures and your blood sugars and so on. So the basic difference there would be the special eye test for the operator medical. The operator medical is signed off by an occupational medical practitioner, what we call the OMP. The occupational health nurse does all the screening, and then if there are any referrals, it will be done, but the final sign-off is by the occupational medical practitioner. The occupational health nurse reviews as well as the occupational medical practitioner, because the OHNP, or the occupational health sister, basically is on the side of evaluation in terms of exposures and doing medical testing, as well as taking the history. So it is basically a screening function, whereas the occupational medical practitioner will become aware of any disease that has resulted from the person's job and will then manage the disease process. The type of work that you can do if you have an operator medical certificate is more in heavy industry. It also incorporates working on heights. If you're an electrician, you would have an operator medical certificate. And the type of industries that require operator medicals also incorporates the transport industry. Basically, all the person's eyes, ears and lungs, everything has to work perfectly to be able to cope with the heavier industry that they find their jobs in. The Keystone Vision test is the one that you would do if you do an operator medical, and it is like the test that you do if you want to have a driver's license. The test comprises of your near vision, can you see clearly near, and can you see properly far. But it also checks whether or not you are colorblind, and what is your peripheral vision, can you see on the sides, your night vision is also covered in the Keystone test. So overall, it's a more in-depth eye test that makes sure that you can see very nicely. An ergonomics medical basically is a screening of the person in their work environment. What are the actual actions that they take? So the mechanics of the body, the mechanics of what is the job, what do they do? Do they move things repetitively? And what do the muscles do? And is there any strain that develops? Also lighting, sound. So it looks at also the psychological side of doing a repetitive job as such. So that is basically what an ergonomics medical is. The ergonomics medical differs from an Annexure 3 medical in that it looks more in depth at the musculoskeletal and the function of the body. This is typically industries where it is heavy work on the body. So musculoskeletal questionnaires are used in an ergonomics medical, and the testing and screening involves strength and weaknesses of the musculoskeletal system. Should you have experienced a long-term physical risk in your working environment, what should you do about this? Basically, there should be a history of the times that you have had difficulty and have had to cope with perhaps strains and sprains or pains, and so that history is then put forward to your employer. Everything related to your body and also the risks to your body is presented to the employer. And you would also have to have a proper evaluation by an occupational medical practitioner to discover whether or not there is a disease process that has taken place. And should that be the case, you would then have to seek a medical with an occupational specialist, and that specialist will decide whether or not this is an occupational disease and can or may not decide to board you, in which case you would then not be able to continue doing that particular job. Ergonomics is definitely covered by the Occupational Health and Safety Act because the different parts of ergonomics is almost unseen as it resides within all occupations. And so the safety of employees relating to the principles of ergonomics is definitely covered under the Act. The test that we do in a medical examination comprises of testing the basics of all the body's systems, and should we have any abnormalities obviously we will refer you for further care. The other testing that we have requisition for is biological monitoring, which is certain tests that need to be done based on the environment that you work in. So if you are, for instance, a farm worker and you do crop spraying, you are exposed to pesticides, and we would need to test your blood to make sure that you haven't got any accumulation of pesticides in your body. Biological monitoring is basically your body's biology, and we want to monitor if your body's health has been affected. So some examples of biological monitoring would be pesticide workers and workers that work in heavy industry where there are lots of toxins and fumes like lead and metals. And so we would like to see if it's in your blood, is it in your urine? So basically we call that biological monitoring. And as well as the food industry, we would look for any bacteria or any viruses that may have affected your body, to find out if there is any immunity, if there's no immunity. So yes, it is about your biology and your body and what you're exposed to. X-rays in occupational medicals are required for industries like the mining industry and also industries like as people that work with asbestos and or heavy dust environments. So we would like to see that your lungs are healthy for your job. So that is why we require that you do an X-ray. The tests required in occupational health would be your basic screening tests regarding the basic condition of your body, and the tests that are required for specific work environments are separated under specific categories, and those would be blood sugar as well as your vision. Doing a screening test for like a keystone test, as well as toxicology drug testing, where an employer would like to know that you are drug-free, and so that type of testing would also come into and is important for your safety at work. So forms a big part of your occupational fitness testing.